it says upper respiratory, it affects the entire part of the lung, but mostly it affects the upper part of the lung. Why, you tell me?
Because there is a high oxygen.
High oxygen tension. You have in the apical area, you have an high oxygen tension. What is the disease which causes this tuberculosis? What is the organism? What is the bacteria? Mycobacterium tuberculosis. Mycobacterium tuberculosis, it causes infection. That infection will call the disease suffering by the Mycobacterium tuberculosis will call it as tuberculosis. Mostly will have in the apical area. Why? Because of the high oxygen tension. Why high oxygen tension? Why not carbon dioxide means? Because it needs oxygen to very good growth. It needs oxygen for the growth. That's why it goes and stays in the apical area. My God, I am getting net here. I never used to get net.
Those are the mycobacterium tuberculosis.
Yes, this is the Mycobacterium tuberculosis. Okay, epidemiology will have a pulmonary tuberculosis almost 1/3 of the population with 2.5 million deaths. Tuberculosis is the communicable chronic, it is a communicable disease also, it is a chronic granulomatous disease caused by Mycobacterium tuberculosis. It usually involves the lungs and may affect any organ or tissue in the body. Okay. It does not affect only the lung, it can affect from hair till toe. Classified into a primary, progressive, secondary, then based on the location it can be classified as an pulmonary tuberculosis or extra pulmonary tuberculosis as well as disseminated tuberculosis. One by one we will go. First we will go for primary tuberculosis. This is a primary infection. What does this picture shows?
By talking.
Very good. Next.
For kissing.
Where he is kissing?
By
Indirectly kissing.
Indirect kissing. Distant kissing. This is a very, he is an intelligent answer. Distant kissing. How he is? He is supporting you. What happens by distant? It is not by distant kissing. It is by speaking. A person who is, for example, X is suffering from tuberculosis. When he is talking to a person Y, okay, or else X1, X2, who is normal, but who can be a susceptible person whose immunity is less. When this tuberculosis patient when he is in active stage, when he talks, millions of bacilli will come out, okay, or else when he is cough, mostly during cough, millions of bacilli will come out, and a person who is near to him will inhale. Will take a breath. When inhale, goes to the trachea, lung, and it gets deposited in the upper part of the lung, apical area, and thereby it causes tuberculosis. One more point is, not all the individuals suffer from tuberculosis. In the patient X is tuberculosis, patient X1, X2 who is talking to him, who is having a very good immunity. Yes, when he is an good immunity, even though he engulfs those Mycobacterium tuberculosis bacilli in his body, he won't suffer from tuberculosis when he is having a very good immunity. Clear? Statistics, this is a long back statistic, almost some 10 years back they say that from WHO that out of 4 individuals, 1 are suffering from tuberculosis, but he is not showing any kind of signs and symptoms. But when his immunity is low, then he may have an infection. Okay, there is a chance of, we will call it as latent infection. Okay, one by one we will deal it now. Primary tuberculosis develops in a previously unexposed, unsensitized person, first time. Gaunt's focus, first site of infection we will call it as Gaunt's focus, very first site. We are dealing with the tuberculosis. First stage is primary tuberculosis, develops in a previously unexposed, unsensitized person, that is for the first time. Gaunt's focus is the first site of infection. For the first time, the X has been infected, that site we will call it as Gaunt's focus. Next, the Gaunt's focus will land up with Gaunt's complex, in the sense Gray white inflammatory consolidation, center of focus of undergoes caseous necrosis, hilar lymph node involvement. These three we will call it as Gans complex. It's clear? The first site we will call it as Gans focus. After that focus, the next, if the same individual landing up with these three features, we will call it as complex. Complex is the material of 2 or 3, right?
So the disease has progressed.
Progressed. This is the Gans complex. I said you what is the Gans complex? 3 features. What are the 3 features?
Consolidation of the white inflammatory.
This is the consolidation. Okay, this is the consolidation. Next, caseous necrosis. If you see in the microscopy, you will see a caseous necrosis. Apart from that, hilar lymph node involvement. Hilar lymph node. Here you will see the lymph node, hilar area. Okay, lymph node also will get enlarged. Next stage, Gans focus will land up with Ranke complex. Next progressive to Ranke complex. What is that? A Gans focus undergoes a progressive fibrosis and calcification. It causes Ranke complex. So on. Fibrosis. This is part is the fibrosis. Next, we have seen the first stage is what? First stage is before Gans focus. It comes under the title of
Primary.
very good. Now we are going to progressive. It is primary is progressing now. In persons with weak immune response, primary tuberculosis progress to pneumonic consolidation of middle and lower lobe, hilar adenopathy and pleural effusion. As I said you in my first slide, the tuberculosis will affect the apical area. Now from the apical area going towards middle, lower, high and pleural effusion. It is progressing. Next stage, pleural effusion and pneumothorax. What is this? Is a pleural effusion and pneumothorax. Extension of the subpleural lesion into the pleura, presence with the dyspnea also. This is the X-ray features. This is the pathogenesis. You know about the pathogenesis of tuberculosis already we had, right?
Yes.
We had in
The
PBL.
macrophage engulfs the bacteria.
Okay.
And then, but it cannot destroy it or do phagocytosis.
Okay.
And after a while, it will rupture. The macrophage and the bacteria will come out of the macrophage.
Okay.
There's a stage or a phase in the disease
Ah.
where it is silent, where the bacteria
Yes.
is inside the macrophage.
Okay.
Then it breaks out and causes further damage.
Okay. Same thing. This is the mycobacteria. Okay. As you know, mycobacteria, it is a double cell wall. We'll call it as an acid phos bacilli. It has a double cell wall in the, we have a microscope, microbiology is a mycolic acid. Okay. So this is the most preventive mechanism from remaining other bacilli. Other bacilli having the pores, which is pathogenicity. But this virulence factor of this mycobacteria is a double cell wall, which protects from the human antibody. What happens is the mycobacteria, this alveolar macrophage, whenever the bacteria, if it is engulfing, we are engulfing inside, going to the apical area, the alveolar macrophages, it will try to engulf those mycobacteria, okay, with the help of macrophage is having a receptor. There is a macrophage Manus receptor for this mycobacteria. It has been capped with this glycolipid. This is a glycolipid. Then in this mycobacteria, it undergoes maturation arrest. Initially maturation arrest. It try to arrest it. Okay, but what happens due to lack of acidic pH, ineffective phagolysosome formation? Actually, what happens? The function of this macrophage is phagocytosis. But this Mycobacterium tuberculosis is so dominant enough, it is not allowing to undergo a phagolysosome. Okay, it is not allowing to have an acidic pH also. Initially, if 1 or 2 particles is okay, but what happens? This Mycobacterium tuberculosis, it is numerous. So it is so dominant enough, it is not allowing to phagolysosome. It undergoes, apart from this, the patient will undergo a polymorphism in NRAMP1, and in the macrophage itself, it undergoes multiplication. Numerous Mycobacterium tuberculosis has been have been having a growth over inside the macrophage itself. This you will see called as bacteremia with seeding with multiple sites. From here, it goes to the various sites. This occurs within 0 to 3 weeks. After 3 weeks, we will call it as this is the primary tuberculosis. This is a pulmonary tuberculosis. After 3 weeks, macrophage, alveolar macrophage. This is the antigen. Mycobacterium tuberculosis antigen. This is the class 2 MHC, this is the T cell, this is a T cell receptor. Okay, this alveolar macrophage is initiating the T cell with the help of this interleukin 12. What it does in the sense, whenever any antigen it has been presented to the macrophage, macrophage is having the capacity just to engulf, it can't do more than that. To kill that organism, it needs an help. That help is being initiated by the interleukin 12 towards the T cell. We have an antigen, we will try to kill this antigen, help me. So, in this process, this T cell, what happens? The T cell along with the macrophage is unable to kill that organism because it is so dominant, it is having double cell wall, so dominant, it is having multiplication, numerous bases are there. So, this T cell it needs further help. So, T cell it needs the help of type 1 helper cell. Okay. This type 1 helper cell again they need an help of an further cells. Okay. So, what happens? It been initiated by the interleukin such as interferon gamma, and it activates the macrophage. This macrophage it get activated, and then this activated macrophage it will be transformed into an specialized cell called as epithelioid cell. Okay. Macrophage, then it transforms into modified macrophage, then it transforms into an activated macrophage, then it transforms into epithelioid cells. This epithelioid cell is a classical feature you will see in tuberculosis. How it presents? It presents like a bathroom slipper. Here the macrophage you are seeing a kidney shaped nucleus. This is a cytoplasm kidney shaped nucleus. The whole thing it will transform into a slipper like shape. Okay. That is one of the features. Microscopically you will see this epithelioid cells. Here what you are seeing here, this is the tuberculin positivity hypersensitivity reaction. Here this will do yes, and then apart from that this is the bactericidal activity, it affects the immune system also. Then it initiates the tumor necrosing factor and chemokines, and it recruits more amount of monocyte in the sense macrophages, and it forms a granuloma. This is an epithelioid granuloma. That is what you will see in a type 4 hypersensitivity reaction. Best example of yes. This is the cells. This is the cells mediated hypersensitivity reaction. We will call it as this. In the center you are seeing caseous necrosis. These are all the this is the epithelioid cells. This is the epithelioid cells. These are all the epithelioid cells. These are all the lymphocytes. Again I will tell you how it occurs. Whenever the tubercle basically enters into the trachea, goes to the apical area, it affects apical area. There it stays. It needs oxygen. That's why it stays in apical area. It grows over there. Okay. In the macrophage, after growth of prime, it needs to kill because it won't. It won't allow signal to the T cell itself. That macrobacterium bacilli is been growing over there. It won't allow signal initially. Once it has been seeding, then it will come out. Then it passes the signal. We have an mycobacterium tubercle bacilli in a numerous amount. So what happens? It will send the signal to the T cells. T cells will need a helper of the T1 helper cells. Then T1 helper cells in combination of T cells, macrophages, it needs further cells to break or to arrest the growth of the mycobacterium tuberculosis. In this process, what happens? It will activate more macrophages. And numerous macrophages, numerous T cells, type 1 helper cells, and this macrophages, what happens? It try to form a fence. Okay, this fence, a group of cells, we will call it as granuloma. Okay, this granuloma will occur when a patient is having a good immunity, at least to some extent an immunity. This is a epithelioid granuloma. Epithelioid granuloma in the sense a localized collection of cells with a centrally placed nucleus surrounded by Langerhans Giant cells, epithelioid cells, macrophages. In old patient, this new in recent infection after 3 years through 2 years, you will see in this. After 10 years, you will see plasma cells also and fibroblast also surrounding this. This is the one. First one by one will go. Primary infection. Patient has been infected for the first time, having a primary tuberculosis. Then if it is Immediately he is getting treatment. Having a healed lesion, he will have a scar here. If there is not getting treatment properly, he will end up with a primary progressive tuberculosis. This primary progressive tuberculosis will have again primary tuberculosis, again he has been reinfected, land up with the secondary tuberculosis. This secondary tuberculosis will have a progressive tuberculosis, having lastly miliary tuberculosis. Again here localized caseating, this is the one more condition, you will see it here, localized caseating destructive lesions. Then latent infections. What is that latent infections? These are the courses of the
latent phase is where the bacteria is engulfed by the macrophage and stays in there for a while.
It stays for a while without symptoms. After that, when his immunity is less, again this infection will be dominant and then it will have an infection. Okay. Secondary tuberculosis, a patient having a tuberculosis, again he has been reinfected, will have a secondary tuberculosis. Now we have a primary tuberculosis, progressive primary tuberculosis, will have a secondary tuberculosis and a latent phase tuberculosis. Okay. These are the various clinical courses. What is now secondary tuberculosis? Secondary tuberculosis arises in a previously sensitized host. Already he had been infected once due to reinfection or reactivation. Okay. Either reactivation in the sense whether he has not taken treatment properly, then again he has been reactivated. This is the one most possibilities, because most of the times what happens, the tuberculosis, the duration of the treatment is minimum is 6 months. You have to take continuously, persistently. But what happens, sometimes they miss that course. There is a chance of reactivation. Morphology, patient will have a local progression and caseation will be there. Heals with a fibrosis. Cavity formation, this is very common. Cavity formation only you will see in secondary tuberculosis. Then mostly you will see in apical lesion is the affected area. This is the cavity formation. So first we have seen Ghon's focus, Ghon's complex. Next, Ranke complex. Next, fibrosis, consolidation. This consolidation, what happens over a period of time, it undergoes dissection of the lung and it forms a cavity over there. Okay, this is a primary tuberculosis. These are all the phases you will see in a primary tuberculosis only. Then later on you will end up with the primary progressive. Then here in a secondary, totally it will be destructed. You will have a cavity. This area only initially he had a Ghon's complex. Clear?
This area what?
This point only up 10 years back he had a Ghon's focus. That focus only has been developed over a period of time into a cavity. Now secondary tuberculosis, this is the what you are seeing is a cavity over here. This is an X-ray picture, shows a cavity in the apical area. This is the epithelioid cells, lymphocytes, central necrosis, tuberculous granuloma. We will call it as a tubercle also. Sometimes they will have a Langerhans giant cell. This is the Langerhans giant cell. This is one of the classical feature of tuberculosis. What is Langerhans giant cell? This is the lymphocytes. This is the granuloma. This is the Langerhans giant cells. Langerhans giant cells. Langerhans giant cell. This is the Langerhans giant cell. What is Langerhans giant cell? Langerhans giant cells is a giant cells. Okay. It's a giant cell. It's a type of giant cell. You will see in tuberculosis where you have an necrosis in one area surrounded by cells. Okay. Those cells, it is peripherally placed. Example I can give like a horseshoe. Horseshoe like in a C shape. Horseshoe you have seen? Yes. Same. Yeah, same like that. Same picture like that. Okay. Here you won't have cells. Here. Okay. This kind of pattern you will see in tuberculosis. This is the caseous necrosis. Why I say it's caseous necrosis? Why not coagulative necrosis?
Because the architecture is preserved.
Very good. The architecture is preserved in?
Caseous.
No.
Sorry, coagulative.
Coagulative. Here, where is architecture? Nothing is there. No cells, nothing will be there. Only pinkish material, no cells. Only you will have no nuclei at all. Even though the cell will have only cytoplasm, even it will be broken out. Only see, nothing is there. Cheesy material, like a cheese. What we have cheese, we call it as a cheesy material. Cheese, nothing is there. Only you touch. If you touch a patient having a tuberculosis, a necrosis, if you touch now, it will break. If you keep press, it will be again breaking. It will be like a powdery material. Okay. If you touch, it will be like a cheesy. This is the necrosis, caseous necrosis. This is the Langerhans giant cell. Now, we have seen now primary tuberculosis, primary progressive tuberculosis, secondary tuberculosis. Now we will go for miliary tuberculosis. What is miliary tuberculosis? Can you tell me? Miliary.
Supposed to be systemic.
Systemic, yes. Then how? It's very simple. Now see, other than the lung, sometimes in the lung also it can occur. From the lung it starts and it goes back to the lung also. That also miliary tuberculosis. Sometimes from the lung, most of the times it goes to the spleen, brain and other parts of the area. We will call it as miliary tuberculosis. Systemic circulation from through the pulmonary vein, goes to the left heart, goes to the systemic circulation. From here it goes to the various organs. We will call it as miliary tuberculosis.
May it affect the heart?
Very rarely. There are less number of articles. Huh? Most commonly it will affect the bone, vertebrae, bone.
Potts disease.
Huh?
Potts disease.
Potts, we will call it as a Potts disease. Then it affects the skin, it affects the liver, it affects the kidney. These are all the main common. It can go, there are articles are there, but very rarely. But most commonly these are all the most commonest areas. Then through the pulmonary area goes to the lymphatic, venous system, right heart, pulmonary. Again it goes to the pulmonary. We will call it as miliary tuberculosis. Why miliary tuberculosis? In the sense, millet seeds like what we have in the kitchen, millets, small millets. We will call it as millets. Okay. Just check it out in the Google. What is millets? You will know what is the kitchen material. Same like that kind of presentation patient will have in the lung. That's why it called as miliary tuberculosis. This is one lung. This is a seeds, millet seeds like. This is from the lung itself. Okay. Diffusely it is present. Miliary tuberculosis, it can affect the retina, spleen. Then we will go for extrapulmonary. It can affect in extrapulmonary sense. Apart from lung, straight away it can affect CNS, lymph node, bone joint, intestinal, kidney, adrenal, endometrium, fallopian tube, testes, pericardium, skin and peritoneum. These are all the extrapulmonary tuberculosis. Is it clear? Yes. Next, this is the tubercular lymphadenitis. From here, most commonly from the lung it goes first to the lymph node only. I forgot to say you that. First it goes to lymph node, from lymph node only it goes to the other organs. This is what you are seeing is a cold, we will call it as a cold abscess here. This is the anterior cervical area, posterior cervical area, cervical nodes. We will call it as a collar stud abscess. In the, we have a collar, right? So in this collar area we will have an abscess. We will call it as a collar stud abscess, mostly due to tuberculosis. It's all about tuberculosis. So we have seen in the tuberculosis like caused by Mycobacterium tuberculosis. Patient will have a primary tuberculosis, progressive primary tuberculosis, secondary tuberculosis, then miliary tuberculosis. From the lung it goes to the other organs. We will call it as miliary tuberculosis. You have seen millets. What is millets? You have seen? Okay, fine, no problem. You can see it later. Okay. Shall I go for the next session, or you want to have